All right, welcome everyone. Today we're going to dive deep into something that affects millions and millions of us. Acne vulgaris. It's one of the most common skin disorders in the entire world. It usually kicks in around puberty, but honestly, it's so different for everyone. When it starts, how bad it gets, and when it finally decides to pack its bags. And here's the thing, it might look like it's just a skin-deep problem, but its impact? Oh, it goes way, way deeper than that. So let's get into it.
And this really gets to the core of why this topic is so important. We're not just talking about vanity or cosmetics here. The source material is super clear on this. Even a quote-unquote mild case of acne can cause some serious emotional distress. We're talking about a real hit to your self-esteem, your confidence. It can be tough. And that's exactly why understanding what's going on and knowing about safe, effective treatments is so crucial. The good news? And this is a big one. Acne is absolutely a condition we can manage effectively.
Okay, so what is acne really? From a medical standpoint. Well, the official definition is a multifactorial inflammatory disease of the pilosebaceous gland. Whoa, okay, let's unpack that because it's a mouthful. Multifactorial. That just means there's no single villain. It's more like a perfect storm of different things happening all at once. Inflammatory. This is a huge piece of the puzzle. It's not just a clogged pore sitting there, nope. It's your body's immune system going on the attack, which is what creates all that redness and swelling. And that last part, the pilosebaceous gland, that's just the fancy name for your hair follicle and the little oil gland attached to it. Think of that as ground zero, the very spot where every single pimple begins its journey. All right, so here's the game plan for today. First, we're going to look at the science of a pimple. Then, what are we even trying to achieve with treatment? After that, we'll cover topicals and lifestyle stuff, the first line of defense. Then we'll get into the heavy hitters, the powerful systemic meds, and we'll wrap up with a really important topic, acne, pregnancy, and breastfeeding.
Okay, let's kick things off with the science of a breakout, because really, if you want to understand the treatments, you've got to understand the problem, right? So let's zoom in, way in. What is going on deep down inside a single pore that leads to a pimple? Well, it's actually this really fascinating four-step chain reaction.
So it really boils down to these four key things happening one after the other. Step one is something called follicular hyperkeratinization. The best way to think about it is like a cellular traffic jam right at the top of your pore. Your skin cells are supposed to shed, but here they get all sticky and pile up, creating a plug. Step two, that plug creates the perfect little home, a place with no oxygen for a specific bacteria called C. acnes to move in and start a family. Step three, your body starts producing a lot of extra oil, or sebum. And what does that bacteria love to eat? You guessed it, sebum. It's like an all-you-can-eat buffet. And finally, step four. Your body's immune system sees all this chaos and sounds the alarm, launching an inflammatory attack. And that's what we see and feel. The redness, the swelling, the pain. It's those four things together that create a pimple.
Okay, so the very first stage before things get red and angry are lesions called comedones. You and I know them as blackheads and whiteheads. They're not inflamed, yet. So a blackhead, that's an open comedone. That cellular plug is right at the surface. And when the gunk hits the air, it oxidizes and turns dark. And no, it is not dirt. That's a huge myth. Then you have the whitehead, or a closed comedone. That's where the plug is trapped deeper under the skin, so it just looks like a little skin-colored bump.
This is where things start to escalate. Once inflammation joins the party, that simple comedone can turn into what's called a papule, basically a red bump, or a pustule, which is that red bump with a little white head of pus. But it can get way more serious. We're talking about nodules and cysts. This is when the follicle wall actually bursts deep down inside your skin. It spills everything out and your immune system just goes into overdrive. The result is a big, deep, painful lump. And honestly, this is the #1 reason why treating acne is so important. These are the guys that are most likely to leave behind permanent scars because they're doing real damage way down in the dermis.
Okay, so now that we know how a pimple forms, that brings us right to the next big question. What are we actually trying to do when we treat it? Because it's not just about getting rid of the pimples you have right now. It's a much bigger strategy, one that's all about long-term control and, just feeling better in your own skin. So there are really 5 main goals here. Goal number 1 is pretty obvious, clear up the acne that's already there. But just as important as goal number 2, stop new ones from ever showing up. It's all about breaking that cycle. Third, and this is a big one, is to minimize scarring. We just talked about how those deep lesions can cause damage, so this is a huge priority. Fourth is tackling what's called post-inflammatory dyspigmentation. You know what I'm talking about, those annoying red or brown spots that hang around for ages after a pimple is gone. And number 5 brings us full circle. It's to minimize that psychological toll we talked about at the very beginning.
So, with those goals in mind, let's start with the first line of defense, stuff you put directly on your skin and whether lifestyle choices can make a difference. For most people, this is square one. All right, let's talk about the stuff you always hear. Does your diet cause acne? Are you breaking out because you don't wash your face enough? What about sun exposure? Is a little tan going to clear things up? These are probably the biggest questions out there, so let's dig into what the science actually says.
Well, the truth is, it's a bit complicated. When it comes to diet, the evidence is pretty mixed. Some studies hint that things like high-sugar diets and dairy might be linked to acne, but it's definitely not a magic bullet. Changing your diet alone probably isn't going to cut it. What about cleansing? Well, washing your face twice a day seems to help a bit with blackheads and whiteheads, but the overall evidence isn't super strong. And sunlight? That's a hard no. It might seem like it helps in the short term, but the long-term risks of sun damage and skin cancer just aren't worth it. Plus, it can make those dark spots even worse. So the bottom line from the experts is that real management comes from medical treatments.
Okay, now for the actual medical treatments you put on your skin. These are the real workhorses. First up, you've got benzoyl peroxide. This stuff is great because it's antibacterial. It kills the C. acnes bacteria. But here's the kicker. Bacteria don't become resistant to it. That's a huge deal. Then we have the topical retinoids. These are like the gold standard for unclogging pores. They directly target that cellular traffic jam we talked about. Next are topical antibiotics. Their job is pretty straightforward. Reduce the amount of bacteria on the skin. And finally, there's azelaic acid, which is a cool multitasker. It unclogs pores, it's antibacterial, and it helps fade those stubborn dark marks.
Now if we zoom in on just the retinoids, you'll see they're not all the same. There are a few different kinds, and each one has its pros and cons. Tretinoin is kind of the classic. It's very effective and usually cheaper, but it can be pretty irritating. On the other end, you have adapalene, which is known for being much gentler, making it a great starting point. And then there's tazarotene, which is the most powerful of the bunch, but that extra power can also mean extra irritation. So you can see why a doctor might pick one over the other based on your specific skin and situation.
But what if the topicals just aren't cutting it? Or what if you're dealing with more moderate to severe acne right from the get-go? Well, that's when you have to go to the next level. Systemic medications. These are pills you take that fight acne from the inside out.
Now, when it comes to taking antibiotics for acne, the rules have really changed. Today, the go-to options are usually from the tetracycline family, like doxycycline or minocycline. And this is super important, how they're used is key. To prevent bacteria from becoming resistant, you always have to use them with a topical, like benzoyl peroxide. They're also not meant for long-term use. The goal is to keep it to 3 months if possible. And you should never, ever use them all by themselves. It's always a team effort with topical treatments.
For a lot of women, acne is hormonal. You see those flare-ups that seem to sync up perfectly with your menstrual cycle. For them, hormonal therapy can be a total game changer. Some birth control pills work really well for this, and another amazing option is a medication called spironolactone. It works by blocking the effects of certain hormones on your oil glands. It can be incredibly effective, but there's a catch. Because of how it works, it's absolutely essential to be on reliable birth control while taking it.
And that leads us to the big one, the most powerful weapon we have against acne, isotretinoin. You might know it by its old brand name, Accutane. This is an oral retinoid, and for people with really severe, stubborn, or scarring acne, this medication can literally change their lives. What's so amazing about it is that it's the only drug that can put acne into long-term remission or even cure it for a lot of people.
But with great power comes great responsibility. Isotretinoin is a very serious medication with significant risks that have to be managed carefully. The number one risk is that it is a teratogen, which means it causes severe birth defects. This is an absolute. There's no gray area. That's why women have to be on 2 forms of birth control and get regular pregnancy tests. The common side effects are also no joke. We're talking intense dryness of your lips, skin, and nose, plus maybe some muscle aches and sun sensitivity. It's a medication that requires a serious commitment to follow-ups and lab tests with your doctor. Now there's a big topic we have to address, the potential link between isotretinoin and mental health issues like depression. You've probably heard about this. The source material is very careful here. It says the evidence is inconclusive. And here's the tricky part, severe acne itself is already linked to depression and anxiety. So it's hard to tell what's causing what. In fact, major scientific reviews haven't found a direct link, and some studies even show that as people's skin gets better, their mood improves. Still, it's absolutely vital that this is discussed with your doctor before you even think about starting it.
All right, let's wrap up with an incredibly important section: how to safely manage acne when you're pregnant or breastfeeding. As you can imagine, this is a time when safety is the #1 priority, and the rulebook for what's okay and what's not changes completely.
During pregnancy, the list of what you can use gets a whole lot shorter. Topicals like benzoyl peroxide and clindamycin, they're generally considered safe, mostly because very little gets absorbed into your body. But a lot of the heavy hitters are completely off limits. Topical retinoids? Nope, not enough safety data. Oral tetracycline antibiotics are a definite no. They can affect the baby's teeth. Spirolactone? No way, because of its hormonal effects. And isotretinoin, as we've said, is absolutely 100% contraindicated. It is a known teratogen.
Now, for breastfeeding, the situation is a little different, a bit more flexible. Most topical treatments are fine, again because so little gets into your system. If you need an oral antibiotic, something like erythromycin is usually the choice. And interestingly, spironolactone is actually considered compatible while breastfeeding. But tetracyclines are still not recommended for a long time, and isotretinoin is still a hard no simply because we just don't have the safety data. So what's the big takeaway from all of this? After digging into the science, the goals, the treatments, it's this: acne is not a one-size-fits-all problem. It's complicated, for sure, but it is absolutely, positively treatable. The whole point of this was to give you the information you need to go and have a really productive, informed chat with your healthcare provider. There's no magic wand, but there is real science and there are real solutions. The challenge and the goal is to work with them to find the right path for you. Thanks for joining me.